Hi all, welcome to my channel. Today we are going to discuss about pleural effusion. So let's move on to the topic. What is pleural effusion? Pleural effusion is the collection of fluid in the pleural space. I have given an image in that you can see the right lung looks like the normal lungs, but in left lung there is fluid accumulation. The bottom of the left lung is filled with the fluid, right? Normally our pleural space have little amount of pleural fluid that is around 10 to 20 ml. This fluid keep the pleura moist and it helps to reduce the friction between the membranes when you breathe. When this pleural fluid is exceed more than 20 ml, we can call it as pleural effusion. This pleural effusion can occur on the right side of the lungs or left side of the lungs, or sometimes both lungs can also be affected. Assessment. In assessment, we can see there will be sharp pleuritic pain, especially on inspiration. And there will be progressive dyspnea with decreased movement of chest wall on the affected side. And there will be dry and non-productive cough that is caused by bronchial irritation or mediastinal shift, and there will be tachycardia, elevated temperature, decreased breath sound over affected area. And when we are doing chest X-ray, we can see there will be pleural effusion on the affected side and there will be mediastinal shift towards the unaffected side. That point you should keep in your mind. This mediastinal shift can occur when the pleural effusion is more than 250 ml. I will show you the image. The first image, that is pleural effusion without mediastinal shift. In that image we can see the trachea is straight up and down and running along the center of the front side of the throat. In this first image there is no tracheal deviation, only pleural effusion present. But in second image we can see there is shifted mediastinum. We know in thoracic cavity the right lung have their own space to sit, the heart have their own space to sit, the left lung have their own space to sit, right? In this pleural effusion, the pleural space filled with fluid which is more than the normal level, but there is no space to accommodate those fluids in the pleural space. So, the structure in the thoracic cavity normally get pushed to the opposite side, resulting upper and lower mediastinal shift. The upper mediastinal shift means the trachea is deviated towards the unaffected side. The lower mediastinal shift means the lungs, hearts, everything going to shift from the original position. And the heart, lungs and everything going to compress. So this will be the medical emergency because the venous return going to decrease, reduce cardiac output, BP going to decrease, there will be hypoxia, even shock can occur. That's why the mediastinal shift will be the medical emergency. Next, pleural effusion intervention. Identify and treat the underlying causes. Most of the time pleural effusion secondary to some other disease condition like congestive heart failure, kidney failure, pulmonary embolism, trauma, infection. So we need to identify and treat those underlying causes. And we need to monitor breath sound, place the client in high Fowler's position and encourage coughing and deep breathing, prepare the client for thoracosynthesis. If recurrent pleural effusion, then we need to do pleurectomy or pleurodesis. What is pleurectomy? Pleurectomy is a type of surgery in which part of the pleura is removed. Next, pleurodesis. In pleurodesis, they are injecting a medication into the pleural space to stick pleura lining together. Pleurodesis is an intervention that is designed to get the two layers of lungs lining, that is the pleura, to stick together. This obliterates the space between the layers so that fluid can no longer build up between the layers. I hope you all understood about pleural effusion. If you want to get more topics regarding Nclex-RN, then please subscribe my channel and press the bell icon so you will get the notification. Thank you for watching. See you again.